We don't always remember names, but a therapist will always remember a patient's diagnosis, which is weird, but I've noticed that in every place that I've worked. So not necessarily, "Did you remember Mr. Smith?" No. "Do you remember that lady that came in here? She had the pelvic fracture and they thought they would never be able to drive a car again, and look at now they're driving cross country." So I love my job.
The MS Positive podcast is a platform where people living with multiple sclerosis come to share everything else they do with their lives aside from being an MS patient. Among our guests are artists, singers, bloggers, actors, authors, DJs, and much more. And yeah, also health professionals because we have to stay in the know. We're more than MS. Today, we have Karen Schiff visiting the MS Positive podcast. She's a physical therapist for 32 years now and the director of outpatient rehabilitation at Memorial Healthcare System. Karen's specialty was working with patients with pelvic floor issues, as well as general orthopedic and neurologically involved patients. In her own words, she says, "I'm honored to work with patients diagnosed with MS." Hails from Chicago but resides in South Florida for the past 31 years and is a strong advocate for all of the patients she works with, always with a smile on her face. Welcome to the show, Karen.
Thank you, Métis. I appreciate it. Thanks for having me.
Sure, it's our pleasure to have you. So, Karen, you have been a therapist for a long time and now you have been directing the rehab center, the main hospital. So, you have seen many cases, many patients. And I would like to know what is the difference in the approach between treating a patient with physical therapy that had an injury and another one that has a neurological condition?
So, whenever we see a patient the first time, we go through a series of questions and a physical exam. I think the difference between a patient that may have a musculoskeletal condition versus a neurologic condition has to do a lot with how your muscles are moving. What's controlling your muscles? Is it pain? Is it your brain or your spinal cord? What's controlling it? So it does make a difference on the type of testing that we do during our evaluation to come up with a game plan to try to, get you back to where you feel that you'd be comfortable at. The testing is different. We do like to put patients that have a neurologic deficit with a therapist who has more experience with that because it's the right thing to do. We do have therapists that have special certifications that can work more with a neurologic population, just like we have therapists that have special certification to work with musculoskeletal injuries. So we each have our own area that we like to go into. Some therapists like to work with all patients. That way they keep up all their skills. That can be quite overwhelming though. Just like the field of medicine and many other fields, there's so many different routes you can go into. It's just whatever you prefer. Do you prefer working with patients that have neurologic insults or those that have musculoskeletal? Or do you want to do both or something a little bit different? It's basically when we're working with musculoskeletal injuries, we kind of know what to expect when we apply a treatment. With neurologic conditions, we don't always know what to expect because the changes between each person are very different and how they respond to our treatment strategies. So, for example, there are some patients that come in, their muscles are very rigid and resistant to moving with a neurologic problem such as MS, and we have some patients that they have more loose limbs, like what we would call flaccid. So, when a patient tells us that it has tight muscles like that, that they're going to the doctor for a Botox injection or something of that nature, we like to be a part of that conversation as well because we want to make sure the doctor, when they're injecting, and most of the doctors are aware of it, the doctors are injecting muscles that we need to be relaxed, but not all the muscles because you need certain muscles to keep you upright and functional. So I think that's the biggest difference, knowing kind of guessing what's going to happen with a patient when you apply a strategy for a neurologic condition versus what the outcome is going to be with a musculoskeletal condition.
You mentioned Botox. I have received those injections, and my experience has been that they have been applied to very weak areas of mine. And so since they relax the muscles, in my case, it caused even more weakness. So it didn't really help when I went to do therapy, like you said, because then it created more of a problem. It made my weakness even more. I couldn't really do the therapy because I didn't have the strength. So it's very individual, no, very particular to each patient. So when it comes to the MS patients, we know that MS causes an interruption in the transmission of the signals from the inside the brain and from the brain to the rest of the body. So you mentioned a little bit of that on your previous answer, that you don't know what to expect because of that same problem. You don't know if the signal is getting there or not to fire the muscles. So is it more PT for people with MS? Is it more about recovering functions, or is it more about maintaining the functions that you still have?
That's a good question, Mady. That's a good question. I would say physical therapy is more not necessarily maintaining. Well, to we want to get up to that point where you are in a maintenance mode. It gets you strong enough to where you can do things for yourself and perform your exercises on your own, and keep it that way. So we want to get you up to the maintenance part, but it's truly rehabilitative as well too. Many cases that I've seen over the years, multiple sclerosis patients they've had a recurrence, and they may have been hospitalized,
Hmm.
and they've lost a lot of strength. They've lost their good tone, their ability to know where their limbs are in space without having to look at them. So they've lost a little bit of the sensation. We're trying to get you to a level where you can, do the basic necessities of life, being able to transfer, being able to, get from one position to the other, get in and out of the car. So if you've been hospitalized, we have to start sometimes from the bottom and work up to get you to that point where we can keep you level so that you can maintain it. So it's a little bit of both. It's a little bit of both. It just depends where you are in your journey with MS, that we will decide what we need to do. Are we at the maintenance level, or do we have room for improvement at this point? And typically, there's room for improvement as well.
Yeah, it must be like a real challenge for the physical therapist when the MS patient is progressing, let's say from relapsing MS to secondary progressive MS. It's a whole different ballgame.
Right, exactly.
So the challenge must be, huge for the physical therapist, and I'm sure that the plan of care has to change around those needs, because when you I experienced that. I went from relapsing to secondary progressive, and I'm a complete different person.
Right.
But still, I don't know, I came out of the ashes, and I
Yeah.
was able to function, like a 95%. But then things started to spiral down, and everything changed because I lost sensation, strength, developed atrophy, lots of spasticity, and that got in the way of my therapy sessions. So,
Yeah. They had to stabilize you, I guess, medication wise, correct? First, before you could continue.
yeah, well, I had to switch
Yeah.
definitely to a different
Okay.
medication and add some more to manage daily symptoms. How is the day, a typical day in the life of the director of the
Oof.
rehabilitation center?
So this rehab center, I've been the director now for at least 10 years here now. I guess I have to say I never thought I would be in this position I'm in now, but the opportunity presented itself and I'm grateful for it. I don't physically put my hands on patients anymore, but I will if the need arises. I still have my active license. But basically I come in the morning, and the first thing I think what every good leaders should do is, of course, round with your employees. So I basically go up to each employee in the morning and say good morning, and how are you doing? I know a little bit about each person. You might recognize that too. Like I'll go up to one person and say, "How are those bees doing today, Chris? How are they
Hmm.
doing?"
Yeah.
Or the other Chris, when are you going on your ski trip? I know you usually go this time of year. So I round with everybody, because we do spend a lot of time together. We play together. We discuss a lot of challenging cases together. We work together. Even when we're not at work, we talk outside of work. what else can we try? What else can we try with this person? Does anybody have any ideas? We're constant, or we also research a lot of the journals for the most updated information. So, you know, I just we talk a lot. We just little bits and pieces, just so we make eye contact. Like, all right, I let them know I'm here for you if you need anything, and if I need anything, please be there for me. So,
Hmm.
so that's the first thing in the morning. Just coming and rounding with all the employees. Additionally, stopping to say hello to all the patients in the waiting room. I try to make it a point to try to get to know as many as possible. Remembering their names, just so everybody knows. We don't always remember names, but we remember our patient's diagnoses. A therapist will always remember a patient's diagnosis. So not necessarily, do you remember Mrs. Hayes or do you remember Mr. Smith or no, do you remember that lady that came in here? She had the pelvic fracture and it was a comminuted sacral fracture. And that's how we remember people, which is weird, but I've noticed that every place that I've worked that that's how we remember our patients. And then we always remember, oh, remember they went from this and now they're walking, or they thought they would never be able to drive a car again, and look at now they're driving. They're driving cross country. So, it's so we just anyway. I get off track a lot, but
No,
as
no,
you can
it's
tell,
fine.
I love my job. So, so we just share a lot of information. So as that happens, I also then will, listen to messages. It's my job to intercept the calls or the concerns or complaints, as many people will refer to, and I will return every person's phone call. I also respond to any incidents we might have here in the center. Say if a patient loses their balance and falls, as you can imagine, working with people that have all different types of issues, physical issues or cognitive issues. We have a lot of falls in our department. So I review any falls we may have had. Typically, we don't have more than one a month. We've actually been going quite a long number of months with no falls. We try to keep our patients safe when they're in our care because we're trying to teach them to walk, and you're going to fall. When you're learning and you're getting up, you're going to fall.
Yeah,
We
we don't say the F word.
that four-letter F
We
word,
don't
yes,
say the F
not my
word,
favorite one.
but it's false, really.
Yeah, yeah.
I don't know what you
So
were thinking, but
no, me neither.
it stands for false.
Maybe.
Well, among MSers, we say that a lot. We say we don't say the F word, and I think one of your therapists actually told me that, and I adopted that phrase. We don't say
I
the
think
F
that
word.
was me. I'm like, don't say that F word in this department. Nobody say
I think
it.
I learned it there. You were saying that you remember more the stories than the name, and as a patient, I think that's actually more personal. If you remember exactly what happened to me, and
Yeah, yeah, yeah.
that means that meant something for you. Remember the stories of the people. I think that's more touching than
Oh,
remembering
that makes
just
me
the
feel
name.
good.
Yeah,
Thank you for that.
as a patient, I think that's the way I take it. So I don't feel.
Yeah, we put a lot of energy. We put a lot of
Oh
energy
yeah,
into
for
it.
sure.
And
Yeah,
because of the fact that we get to work with patients 2 or 3 times a week, we get to know them and we get to know their family. We get to know either their likes, their dislikes. We know when there's something going on in the home, like if there's kids that aren't getting along or parents aren't getting along, or patients aren't getting along with their spouses or their parents or their kids. It's very amazing. So you learn a lot. It can be physically and emotionally exhausting,
yes.
but it's the most rewarding thing. So, and I think that's why I make sure I always stay in contact with each therapist, because I know what they can go through in one single day, even in one single session. But basically, I go and I handle all of those issues. I also handle the finance of the department as well.
Very important.
This department, we don't use a lot of supplies, which is good because our supplies are right here. It's our hands
Yes.
and our
That's the
brain.
main tool. The main tool are the hands.
If we're going to spend money in this department, I'd rather spend it on getting additional education for the staff, and because that's what they would like. So always make sure that you're supporting the people around you and support them in the way they want to be supported. Try to come to some agreement as to what we can do to help them grow. So, and I look at the volumes as well. So I'll come in and I'll see, like today, we've got 250 patients coming in today between physical, occupational, and speech therapy, just for adults. So that's from 7 a.m. till 7:30 p.m. Believe it or not, even with having that many appointment slots available, because I have about 15 PTs here right now, there's always patients waiting to get in here. So I have a list of those patients, and we will call them and say, "Can you come in this afternoon? I have an availability," just to try to get patients in. Not necessarily for a financial reason, but that is part of the issue, but also because patients are in great need of coming in. So I make sure that we try to do as best we can to give the patients what's needed.
But you have a great team there. I was a patient at the rehab center where Karen works for 8 years, at least 7 years,
Something like that.
something like that, a long time. So
Yeah.
I got to meet the team, people that are not working there anymore that were great, and the ones that stay that are still working there, and they are, um, very qualified for the job. I mean, I give a lot of credit to the rehab center and Memorial for my miraculous recovery.
Thank you. Thank you.
They work really hard with me and with all the patients, but you guys make the patients feel like family. To tell you the truth, because I consider all of them my friends. I mean, I guess that it was a lot of years. Also, I mean, they had no choice but to bond with me because I was worse than a booger. I was there like
Yeah.
constantly, but
Yeah.
it was so much fun. But I think you guys are great. You have a great team, so you should be proud of all of them, and you're amazing as well.
Thank you.
So
We
thank you
appreciate
for all the effort, because I know that I can see that it really comes from the leader, because you have this energy, this good energy, and you really care for the patients, and I think that transfers to to your therapist there. Yeah,
I
good
feed
job,
I
good
feed them
job.
a lot. That's the secret. I feed the therapists a lot.
You
Okay.
have a very positive,
Yeah.
vibe,
Yeah.
so that also makes a big difference,
Yeah. Yeah.
in the
Yeah. Yeah.
workplace.
We have some pretty traumatic cases that come in here, involved cases. And I think, being able to, I'm thinking of one situation recently that we had. We have a patient that came in that has a certain profession where she was severely injured on the job. She's a little younger than myself. So she's in her early 50s, having to deal with limb loss and the fact that she may not return to her previous job. And she is a single person. You can imagine, as you things that, personally, like patients, people that have MS go through as well, the changes that occur at home. And, as a clinician, I'd like to know that stuff because I like to try to do whatever we can. My team does as well to have patients open up. In this particular situation, this young lady was to several other rehab departments, and she just didn't open up. And all that I heard from a case manager was, "Don't talk about this hospital. Don't talk about that hospital. Don't talk about this rehab center." She doesn't want anything to do with it. I'm like, "Oh boy,
Oh,
we got a tough one coming here, guys." So
mm-hmm.
we had our little powwow, the PT and the OT and myself, and we came up with a plan. And this young lady who thought she was a very active woman before, very active. She was a runner. We talked to her about her goals. And when you have certain things that happen to you, you just think, "How am I? I'm never going to be able to do this ever now." I just, but we asked her when she got here, what are her goals? She was quite honest with us, and we were like, "Well, okay, let's go for it." Her
Yeah.
therapist had a plan in place to
Hmm.
say, "All right, if you're going to go all in with me for this, let's try this. By the end of your therapy sessions, you should be able to, take a hike on this mountain that you wanted to do without a problem." We already have this individual on the treadmill. This person was
Wow.
terrified to walk again. Her leg was also crushed, and she has a rod in her leg.
Oh, wow,
So
wow.
yeah, so all of that, and just to see the therapists work together and come up with something, I think that's what inspires me. Because I'm like, I had no part in that whatsoever, other than let's talk about this. Can we come up with a plan? But just to see it happen and see it unfold, and now this woman comes in here. She doesn't sit in her wheelchair with her head down. She sits up. She's saying good morning. She's saying good afternoon. The whole personality change because she knows in her mind that we're going to help her.
That you got her back. You got her back. She probably felt comfortable enough with the energy there of everybody to open up from the get go. So it's not only what you're saying is that it's not your job is not only the physical recovery, but the emotional recovery of the patient as well, which is actually in my opinion, the most important. Because if your mind is not well, then your body is not
And your
well.
spirit too, your
Your
spirit too,
spirit,
because,
yes,
we
exactly.
several people, like, we've had patients with neurologic conditions to orthopedic horrible orthopedic conditions, and they come in here and they're like, "Why me?" Like, I don't whoever created me, they don't have my back, they lose their
I
spirit,
have asked that question
they
myself.
why me, right?
Why me? I
Right? What's like,
think we all do.
what did I do? What did I do? What do I have to do to get out of this? And it's like, you know what? There's just some things that are not our control. We're human. We're put here for a task and a job. He doesn't have control over that because we're still human. So it's just interesting to see how the therapist can change their treatment plan based on what each person's individual needs are and come up with a plan to meet that.
I don't know if you remember a blog that I wrote. Well, probably not, about the team behind me. And of course, I included my therapist. I said there that I consider you, your team, the rehab center, the pillars of my recovery. They picked me up when I needed them to. They also never gave up on me when I was down. So that was like the most significant part for me of the whole blog, because without that I could not function. Could not function. It's that simple, So it was not just a physical recovery, but also the emotional part of it. So thank you.
You're welcome. You're welcome. It's also very interesting because, you talk about the emotional, the spiritual, the physical. And there's some things that are also we're therapists, but sometimes I think, wow, we really encompass a lot of things. For example, when I was treating patients, I worked a lot with pelvic floor patients. So those are patients, male, female, children, that may have inability to control their bowel or their bladder, or have they have pain in the private area. But it is an important question for a therapist to ask, because not every patient will come out and say, every time I try to change my position, I pee my pants. And
Hey, and with multiple sclerosis, that is a thing.
yes, it is a thing. It
It's a
is.
big
It is.
thing. I mean,
It sure
oh
is.
my goodness, so many patients that I know that have that issue. It's a big problem, and not everybody's willing to talk about it openly either. I made a video. It's on YouTube. Guys, go to the YouTube channel. Well, it's not about that, but that part is included, and I talk about it with somebody else in the MS world, Mel, that has that issue as well, along with others, and it's very serious. And he says it's embarrassing. It's embarrassing, but you know what? Hey, I'm here. I'm showing up. That's how he takes it. But he's been through very, very embarrassing situations. So it's a real thing for
It
us.
is. It can be very,
Hmm.
very challenging to work with, and
Yeah.
to try to control it. It takes a lot of work if
Yeah.
it's going to work. It does take you have to be on a certain schedule, etc. So, even talking about, intimacy with your partner.
I was gonna say it
Yeah,
affects the sex life
absolutely,
for sure.
exactly. Because, we fatigue quickly, patients with multiple may fatigue quickly. And, we can help with, giving you certain positions that are more energy efficient for you. Listen, this is life. This is who we are. This is, we were meant to propagate. So, we got to have these conversations and have an open conversation about it, not be embarrassed, because we're all doing the same thing. We really are.
Yeah.
We're really not different at all.
I guess
So
in the beginning of the conversation, when you first meet your therapist, you don't want to say, you know what, I can have sex and I pee on my
exactly.
pants. Nice to meet you. You don't go to that appointment
We'll be
with
like,
that
I'll be right back.
mindset.
I'll be with my boss. No, no.
But yeah, definitely you have to you have to talk about it. You have to open up, and at some point, you have to discuss it, because it can be there's rehabilitation for those
Right, right.
issues as well, if you address them,
Yeah.
with your
I know it can be
therapist.
a challenge for patients to talk about, or people that are coming for care, but it's also and my goal is to have my therapist ask that question. You have to ask it, because it's not easy for you to bring it up.
I don't think they ever asked me. Was I too hot for them to ask me?
Yes, you were, sister.
I was a lot younger, guys, so I look a lot better.
I know what
I'm
you're talking about.
talking about 7, 8 years ago. And they never asked me. Did they ask me? Maybe I don't remember. Or maybe I have no filter. You know me. I have no. I'm
Oh,
behaving
yes, I
pretty good
do.
in my podcast. I have to say, but you know me. You know me well. I have no filter, and I
That's why I like you so much. That's why I
yeah,
love you.
I like you too for that same reason. I speak before I think. And
That's
so I say a lot of things that are not well received sometimes because I just say it like it is. Maybe I just said it. And he was like, okay, skip next question because I already,
yeah,
told him ahead of time before him asking. So maybe that's what happened. I'm pretty sure that's what happened. But I have memory problems. Thank God in this occasion, I don't remember.
exactly,
So
exactly.
whatever, whatever. Switching gears a little bit here. You have two daughters in the medical field as well.
Yes, I do. I do. I have two daughters, and my youngest one is in California. She is a radiation therapist, and my oldest daughter is lives locally near me, and she is a nurse. So they're both in the medical field, which I'm very happy about.
Proud mama.
Very much so. Very much so. Just grateful that they finished college. It wasn't easy, but they did it. They finished it. Thank God.
And
So,
expensive, I bet.
no,
Expensive.
no, they went to community college. It's okay. They got their. I'm like, girls, this is it.
Hey, why not?
So I have two daughters, and I'm very proud of them. My youngest just texted me this morning and said she just finished her final for her one class. She's getting her master's in dosimetry, which is for radiation therapy. So I was like, "Whoa, look at you!" And then the other girl, she's like, "Oh, but I did this in my master's program."
Oh, they're competing. They're competing to get your attention.
Me, I'm just like, "Thank you, Jesus, thank you."
Oh, you're so lucky. I mean,
Yeah, no,
that's
I am,
you're very
I know,
lucky, very
but it's a lot
blessed.
of work. Matey, it's a lot of work. It's a
Yes.
lot of work.
Tell
Yeah.
me about it. Remember when I first walked in the rehab center before I was diagnosed with multiple sclerosis, or maybe in the beginning. I don't remember well because it was a long time ago. I went for therapy for my little kids. At that time, they were tiny, and they fell in love with your service dogs. Can we talk about Partridge and Gail, please?
We've had Gail and Partridge here. They're both golden retrievers, and
They're beautiful.
they're
They're
gorgeous. They were trained
beautiful.
at ECAD. It's in New York. It's ECAD. It's Educated Canines Assisting with Disabilities. So they're fully trained service animals, but we use them in therapy, and we use them to for a lot of different things. Number one, and you just said it yourself. When a breath of fresh air. As soon as somebody sees the dog and touches the dog, their blood pressure reduces. You can see them calm
It
down.
changes the whole dynamic,
The whole vibe is
the whole
changed, right?
vibe. The energy changes. It's so
Yeah,
refreshing, and people
yeah.
like relax
Yes,
when they're
yeah,
around.
yeah. Because for us, for a therapist to tell a patient, just relax. That's the worst thing you can do,
Yeah,
right? You can relax.
exactly. It,
Bring a
it
dog in the
works.
room.
It just works. It just
Yeah.
works. Yeah.
Yes. So yeah, we do enjoy having the dogs here. We've used them for adults as well as pediatrics. One of our dogs actually is trained to work with those individuals that are on the spectrum of autism. So when a person is having kind of like a mental breakdown, or they're just melting into their own world, I learned this the hard way with one of the dogs. I was sitting in my office with it was Gail, excuse me. So this is another dog, Gail. Gail got up from my office and she went down to the front lobby and sat down in the chair that a child was sitting in at the front desk, and the child was doing certain behaviors that are common with those that are on the spectrum of autism. So as soon as the dog came up to him, the child stopped and went to the dog to pet him, and everything, it just stopped the whole
It
situation.
changed
The dog
everything.
changed it completely.
Wow.
So the dog basically laid on the kid's feet to calm them down. That's
Oh.
what they do. They put pressure on them, and that does relax them. It calms them down.
So the
So
dog is actually trained to
yeah, yeah, to
they
feel that
to
energy in the
put
air.
pressure on the feet to calm the.
Yes.
That's
No.
incredible. That's
Well,
incredible.
sometimes if it's a smaller child and they're on the ground, the dog would go and lean up against them, or maybe we'd put the head on the belly of the kid.
Oh.
But it really makes such a difference, and like you said, it changes the whole.
It
vibe
does.
in the
It's
air.
just
Yeah. So, and I learned it the hard way. Then I called the home handler, and I said, "Your dog just ran out of my office." She says, "Oh, was there a kid with autism there that was having a breakdown?" I'm like, "Yeah." She's like, "Oh, I forgot to tell you, the dog is trained to work with people on the spectrum of
oh
autism."
wow. That's
I was like,
incredible.
he said, "Well, let me
Incredible.
tell the dog knows his skills." It was
That's great.
amazing. The parents were absolutely in tears. They
Wow.
were like, "Where can we get
I
a
mean,
service
I'm
animal?"
here
You
getting the
know?
teary eye as well. That's so sweet. I remember I had an experience similar, but not in the rehab center in particular, but something similar happened to me. Hear me out. I was in a yoga class. It's a yoga class for MS patients. This girl has two service dogs, or in her house, there's two service dogs. So she brought her dog. I probably was a little late to the class, and as I'm sitting down, the dog approaches me. Huge dog. I mean, I like dogs, but this was like a really big dog, and it kind of intimidates me a little bit. And she just put her two paws here, and her face was here, like she was giving me a hug, and she kind of that's how it felt, like she was
Yeah.
greeting me, and
Yeah,
that's obviously how the dog
yeah,
did it.
yeah.
Put the paws
Wow.
here, came up to me, and I'm sitting there like this, and I'm like, what am I like supposed to
Is this
do?
dog gonna bite me? What's going on over here?
I didn't feel fear. It was intimidating because of the size, but it was the opposite. Like I felt love. Like she was giving me a hug. It's the first time this dog saw me. And as far as I know, dogs that are like service dogs, you're not supposed to pet them. They're not supposed to be interact with other people because it throws off the training. That's the little bit that I know about it. However, this dog did that, and she was like, she's never done that. I don't know what's happening. And I'm thinking she's sensing that I have MS just like you.
Yep, absolutely,
Does that make
absolutely.
sense?
Yes, it does, 100%.
That was a surreal experience that I had with this dog that I just came across for the first time. But she received me. Like she just,
Yeah, yeah.
like she
She
just was
knew, she
so.
knew, she
Isn't
knew.
that wild?
I know, it's crazy.
That's a
That
real thing. That happened to
it
me.
is, it is. There's dogs that are trained to detect if a seizure is gonna occur or the blood sugar is dropping too low. Their sense of smell is so keen, much more keen than ours is, that they know what's going to happen before it even happens. But in this situation, like you they can sense it. It has to do with we all have our own scent. Their sense of scent is much stronger than ours is, so they can tell when something's different. Like, okay, you're just like my mom. You're just like my mom. Like something is very similar here. So yes, I'm going to receive you because you're just like my mom. It's
It's
fascinating.
fascinating. That's what I was gonna say. It's
Yeah.
fascinating how that happens to me. That was I'll never forget that in my life.
Wow. What
That
a
was
moment.
like, what
Yeah.
is this? It was incredible. It was a surreal experience. That's how I call it. Speaking about animals, you are definitely an animal lover. And
Say that.
wait, way too much.
No, never. Never too much.
This is another side of you, another of your sweet layers. You are very humanitarian and you like the animals. And I always see you on your social media with a new animal. I never know which one belongs to you.
So, yeah, ever since I was a little girl, my father, I remember my dad he worked two jobs because I was the youngest of seven kids. And one of his main job was working for Hearts Mountain, which is a pet supply company. So I'm going to blame this all on my father, who's in heaven looking over me. He loved animals, and it just passed on to me. And we always had cats, we always had dogs, hamsters, gerbils, birds, everything in Chicago. I think as I got older, my kids grew up with dogs and cats. And then, when you go through a part of your life where you're the single parent now, and and your kids are growing up and they're got their own friends and they're not hanging so much with you anymore. You look for something that really satisfies you. Something that fills your cup. I needed something to fill my cup, and I kind of went back to that, and I have more room in my house now. So yes, I do assist I am a bottle feeder for a rescue for cats. So I frequently have litters of kittens at my house that I bottle feed throughout the night. We put them up for adoption.
I didn't know
So,
that part about the bottle
well,
feeding.
I didn't tell
I'm
you that.
just,
Sorry.
wow.
So yeah, so that's the bags under my eyes from
That's
feeding.
because you don't have to be in the office at 8 now.
No, but
You take care of
yeah,
cats throughout the night.
yeah, I know,
That
I
must
know.
be
We have
hard.
a whole litter of them.
How many are in a little? Like how many cats can a little
Man,
like 12?
you can have
5?
a cat can have two kittens, could have eight kittens. It's just
Wow.
whatever. But
Okay.
but so but I'll take them only if someone can grab the mother also because a lot of these kittens are homeless and the parents are too. We want to get them fixed or whatever. So long story short, yes, I have several animals at my house. I have macaws, I have dogs, I have cats, I have a new friend, Ollie.
Holly, yeah. Who is Holly? Saw the new addition to the family.
Ollie is a hamster. Yes. So I haven't had a rescue hamster in I don't know how long. I think I'm getting 2 rescue bunnies this weekend, though. Yeah, I know.
You have space for all that? How many pets do you have in total? Let's be honest.
I have
Are you the lady with a million cats?
I have 11 animals. I had 7 cats, but as of last night, I now have 8. So
Another one.
yeah, well,
There's
one
a new
showed up
one.
in outpatient rehab. I think they can tell where to go, where's a safe place to go. I think the cat belongs to somebody, but it's not chipped, so it's gonna stay at my house until the owner finds me.
Do you do this work with or for an organization in particular, or this is something you just do? Or
No, I'm just out there on my own, and a lot of the organizations, like the rescue organizations, they know me. So if they're looking for a bottle feeder because a mother cat got killed in the street or something, it happens. They can text me, call me, and as long as they can transport or I can get there easily, we'll do the handoff, the kitten handoff in the parking lot. The old kitten handoff.
you just open a new world for me. I had no idea that people take litters of kitties and take them home and feed them throughout the night. Like I've seen the bottle feeding, like maybe at the rescue center, but never thought. Wow, that's a lot of work. So, hey, I salute you, my friend. Hey, I mean, the animals are like babies, are like having your own babies. It require when they're little. I mean, they require a lot of your time.
We all have a job in life, and I think this is just something that was meant for me to do. When you're doing something that you really enjoy and you love, you're like, all right, no matter what else is going on in my life, this is what I'm supposed to be doing.
How long have you been doing that?
About 15 years. Yeah. So I've had several rescue animals. I've had several pass because I keep them till, they're old.
Do you keep any? Do you fall in love and keep any?
Yes, as a matter of fact, it's so bad that my boss called me about a year ago and said, my dog is barking at something in the yard. I said, I'll be right there. And it was a litter of kittens. And I grabbed them all. Yes. And I grabbed mom. And I fixed them all and I put mom back, but I have all the kittens. And I gave 2 kittens to people that work here in outpatient rehab, 2 kittens, and I kept 2 other ones. So
It's been very interesting. We've had a very interesting conversation, and I learned things from you today that I didn't know. I didn't know that you spend your nights bottle feeding cats.
I
I know
know.
you have animals, and you're involved in rescuing them and looking after them, but I didn't know that it went that far.
Yes.
So I'm even more proud of you now because
Thank
that's a
you.
lot of work, and
Yeah.
it's a nice and sweet thing to do. So say
Oh,
hello to Partridge, my
yes.
favorite.
I will.
I
Oh,
want to hug
absolutely.
Partridge. Remember, I used to call him P because
I know.
I couldn't say
I
the
remember you
name. This is ridiculous. My English is not very good
called
looking.
it parchment.
I
What?
had no clue how to say the name, so I called P. It's hi P, how's P? That was the best I could do.
That was very smart. It was a
But
good idea.
but I finally got it right. So Partridge.
Partridge. You got it.
So give him a hug. So thank you so much for being in the podcast. We learned a lot. You gave a really good insight about the therapy from your point of view, and I know the other side, the patient, but it's interesting to hear all the information you had to
Thank you.
give us about what goes behind treating a patient with a neurological condition that for sure has to be complicated for you guys. I'm very thankful that you exist and your team and that we cross paths because definitely helped me a lot with my recovery process. And I learned a lot because not only, I recovered, but I learned those are things that I can still do, like, how to work out at home and try to strengthen my muscles from home or from the bed when I couldn't get up from the bed, things like that, that I learned from your team.
Right, right. Good. I'm so proud of
So,
you. Very
yeah,
proud of you. Me
thank
too.
you. Thank you. So, thank you for being here. I adore you and I miss you lots.
I
So,
miss you too. We'll
when
be
I
in
go to
touch.
Florida
Yes.
to pick up my dog, I'll come
Okay.
see the guys at the rehab center and pick
Stop
up
in
the dog
anytime you
from
like.
you.
Thank you. Thank you,
Thank you
Mickey.
so much. I'll
My
see you
pleasure.
next time. Thanks for being here.
You
Love
got
you.
it. Love you too.